Good afternoon. I'm here to provide the daily press conference in relation to COVID-19 pandemic. So in the last 24 hours, I can report that we've seen 23 new confirmed cases in Australia. 1 in Queensland, 1 in New South Wales, and the remain in Victoria. 15 of those in Victoria are as a result of overseas travellers returning to Australia. They are Australian citizens or residents returning here. And I think it's important to remember in the context that we are seeing about 6,500 people or Australians returning to our shores every week. And so whilst these numbers are a little more than we've seen in recent days, we are seeing people return from places where there is a very high prevalence of COVID-19, and so we should continue to potentially expect to see people returning. Important to remember everyone is in quarantine and they are strictly adhering to that 14 days, but it's just a little rise in those numbers. One of the other cases in Victoria today is in an aged care facility that's currently now in lockdown and following those very clear guidelines about how one manages an outbreak in an aged care facility. So we'll currently constantly monitor and watch that. So currently overall, throughout this pandemic now, 7,370 cases in Australia. We've seen 16 people remaining in hospital, sadly 3 of those in intensive care, and as we reported previously, 102 deaths, sadly, in Australia. So those are the figures that we have for today. The other thing of note that we are seeing media reports in today from the UK is early media reports, at least, on the success of the use of a very commonly known drug, dexamethasone, in the use of patients either in hospital, either requiring oxygen or requiring ventilation. Now, we're cautiously pleased to see this report, but obviously these reports are currently media reports, and so AHPPC have considered that today, and it will be making a statement in relation to that study reported in the media. But we must remember that even if a treatment has been found, and we will need to see the published data, that does not in any way detract from the need for us to continue to prevent the spread across Australia. So we need to continue to do those things that we've been doing to prevent the spread of COVID-19 so that, in fact, one would never need a treatment. So that's our report for today, and I'm happy to take questions.
You mentioned there that the biggest cluster, for want of a better word, of the cases that we've seen are from overseas travellers. Are you expecting that as social restrictions continue to ease, that we might be seeing clusters in the public as opposed to those groups of people still returning from overseas?
We are seeing small community clusters. We know we've seen that in Victoria, and we do and did say as we ease restrictions we would expect to see these small clusters. The important thing is that Victoria have moved quickly in containing that small outbreak. They're doing extensive testing and contact tracing, and that's what we need. So we need people, if they've got symptoms, to quickly get tested, and therefore we can then get in contact, obviously particularly helpful if they've got the COVID app, and we can contain those outbreaks to small numbers.
We started seeing over the weekend crowds returning to some sporting matches, of course something that many Australians want to see, but is there anything that health authorities have observed about the measures put in place at sporting grounds over the weekend that were successful, or anything that needs to be stepped up as more grounds open up their doors again?
I think it would be fair to say I know that in South Australia the Chief Health Officer was actually at the football to see how things were going, and I think she reported that she was very pleased to see the measures that were in place that night where the two teams played, and will continue. So everyone, there was very controlled numbers, everyone had an allocated seat, there was significant space between everyone, and everyone was encouraged, of course, not to attend if they're unwell. They are the sort of things we're going to continue to want to see. I understand there's more plans for crowds this weekend again, and it will be these physical distancing, these hygiene measures that will mean that we can continue to return to the sort of life we remember from the past.
There was a lot of discussion about people attending Black Lives Matter protests and rallies around the country, and the concerns that there could be some community transmission at those rallies. We haven't really seen any cases popping up, maybe one or two that have been linked to the Melbourne situation. Does that suggest that we are in fact getting on top of this virus even more so than what had been predicted?
Well, I think we can say that with the significant success we've had in the suppression of the spread, we are really pleased to see that. But that is as a consequence of people doing the right thing, continuing to social distancing, stay home, hygiene. We need to keep doing those things. We're not out of the time that we may still see some cases from those protests. Mostly the incubation is between 5 and 7 days, but we do know it can stretch 10 to 14. So there is still the potential that we'll see cases from those, but less likely over time. We're really pleased to see that. Our advice was from our HPPC was please don't go, but we are of course pleased to see that we're not seeing significant numbers out of those protests.
I know on the weekend you were saying that there haven't been any strong plans put in place to start relaxing restrictions around international business travel. Of course, we know a lot about this discussion of the trans-Tasman bubble. I'm sure you're sick of being asked questions about it, but has that progressed any further, those sort of plans, or at least getting an idea as to what sort of checks and balances would need to happen on both sides of the border to ensure that something like that could go ahead?
We're constantly reviewing both those travel restrictions and the quarantine requirements based on as we know more about the virus and more about the evidence. But as yet, no, we're concentrating on the borders will remain closed. The rules are still there. I know there are discussions going on around what might be possible, how might you make this work, but at this point in time I'm not aware of any plans of any firm dates for when they would occur. But we can, as I say, continuing to look at how we might do that were a decision to be made to do that.
There's some reporting around this morning about one of the centrepieces of the public health program here, which was the COVID Safe app. Reports saying that at first that app was, on iPhones at least, only effective around a quarter of the time, or even less than that. Obviously not asking you to comment on the technicalities because it's slightly out of your realm of expertise, but do you understand the concern that people might have that they were originally sold what could be a pup hit when they were told to download this app and it probably wasn't working?
Well, I was one of the people that certainly promoted the downloading of that app, and we've seen, I understand from the Digital Transformation Authority, there have been 5 upgrades since then. Yes, we've learnt more about its operational effectiveness and it's working a lot better now than it was in the beginning, but that doesn't take away from the importance of being able to use or supplement our ability to track and trace people contain this disease. And this was always a supplement to the existing public health measures and the containment structures we put in place. And as it continues to be upgraded, we'll see its performance improve.
Do you know if there's been, with some of these cases popping up in the States, any more requests for access from state health authorities to use the app?
No, because if you remember at the very beginning, we were really clear that as the federal government, we weren't able to access that information, that it was only through states and territories. There have been some reporting, as we know, that it's been used where there's been a positive case. But again, we're not privy to that information because we made it so tight in its privacy restrictions.
Just finally, how much attention do you give to other parts of the world when it comes to their easing of restrictions? We know that there's been a lot of work happening in Europe and the UK at the moment. They are starting to see some of those social restrictions wound back. Do you keep a close eye on how that goes as well as an indicator of transferring that knowledge to Australia, or is it a bit of a different kettle of fish because it is such a different circumstance over there?
Oh, our clinical connections and our government connections remain. We're very vigilant to learning and seeing what's happening overseas, and that's important so that we can learn and understand the global picture of this, because that still has an impact on Australia. Only yesterday I was part of an international Zoom meeting of chief nurses and midwives across the world, and the reports and stories, for instance, from Italy, just are a very salient reminder of how fortunate we are in Australia to have not seen. So we keep all of those connections very much tight, and we watch across the world about the evidence and how it's changing and the emergence and changes in the prevalence in different countries.
Are there any hotspots that are of particular concern at the moment?
Well, I think you would not be any doubt to see that Brazil clearly has got some enormous challenges in the numbers of cases and deaths it's seeing at the moment in Brazil. It's very sad for all the people in Brazil with that difficulty.
Thank you.
Thank you.